Welcome to a series of videos on home remedies. Come up with a very important topic on otitic barotrauma. Ascent or descent in flight, you get block sensation in the air or pain in the air or sometimes giddiness. That is known as the otitic barotrauma. The middle part of the ear is connected by an auditory tube known as the eustachian tube. The tube connects the nose, back of the nose to the ear. That tube, known as the auditory tube or the eustachian tube, usually equalizes the pressure between the ear and atmospheric pressure. So, normally, if there is slight change in pressure, the eustachian tube is able to maintain the change in the pressure. However, it's the rapidity in the change that is important. Especially while sea diving or when you fly in the air, when there is a rapid change of pressure, the eustachian tube is not able to maintain that equilibrium. It's not able to equalize the pressure between the external environment and the middle ear. That leads to otitic barotrauma. What happens when you get otitic barotrauma? You will start, getting fullness in the air. The air may start ringing, tinnitus will be there. You may feel, pain sensation. The air will be blocked and your hearing may be reduced. And in severe form, sometimes the eardrum may rupture and blood may start coming out, or you can have a severe spinning sensation, especially if there is a inner ear barotrauma by explosive or implosive mechanism. Then you can have a severe episode of giddiness, vertigo. Most important part is how can you prevent otitic barotrauma. So there are certain maneuvers that can be done in order to prevent barotrauma. The first is swallowing or yawning. The auditory tube that connects the middle ear to the nose, back of the nose, it opens only during certain maneuvers. It's closed most of the time. It opens during yawning or swallowing. So if you have barotrauma and you have a history of barotrauma, and if you want to prevent it, what you have to do is during the time of ascent or descent, because barotrauma happens more commonly in descending time, it is important to swallow or yawn. So once the pilot, announces that it's time to descend, now we will descend and land. Usually they announce the flight. Put something in the mouth, some sweets or something, and then start swallowing or yawning. The next thing is you should not sleep during ascent or descent when there is change in pressure, because the number of swallows decreases during sleeping. So don't sleep during the descent. The next thing is you can do a Toynbee maneuver. Toynbee is you have to the nose and mouth you close and then swallow. Close the nose and mouth, swallow. So when you do that, it builds a negative pressure in the nasopharynx, and then the eustachian tube opens. The other one is the Valsalva maneuver. Valsalva is you have to close the nose and mouth and then blow out in the closed glottis. You have to forcefully blow out. Try to blow out. Actually, the air doesn't come out, is not it? So try to blow out. And then you can do close nose and mouth, blow out like that. But you shouldn't do it very forcefully. If you do it forcefully, there is a risk that suddenly the air may gust inside the middle ear and the eardrum may rupture, and you can cause manual barotrauma by yourself. So don't do it forcefully. Number one. Number two, during cough, cold, running nose, or when you have throat infection, you shouldn't do that. Otherwise, you'll push the bacteria virus inside the ear. So if you have history of cough, cold, running nose during that time, avoid doing the Valsalva. Do a Frenzel's maneuver. Frenzel maneuver is nothing but you close your mouth, open the jaw, and with the tongue, you have to brush the hard palate like this. So the roof of the mouth, you brush with the tongue like that. So close the mouth, but open the jaw. With the tongue, brush the palate, brush the roof of the mouth. This is called Frenzels, and it's much more safer than the Valsalva, because only little air will go inside, and the risk of pushing bacteria virus into the middle air is less. Although it is little difficult to do, but it is safer to do this way. So once more, the Frenzels maneuver. Uh, Close the mouth with the lips, open the jaw, and then with the tongue, brush the roof of the mouth like that. So that's known as the Frenzel's maneuver. If you have previous history of otitic barotrauma, then you are more at risk of having it again. So if you have barotrauma, always carry chewing gum with you and then go in the flight. So at the time of descent or ascent, you can put the switch into the mouth and then start chewing it so that the number of swallows increases. If you have cough and cold, running nose, and you have history of barotrauma, if it is possible, try to postpone your travel. During cough and cold, what happens is that the tube that I was talking about that connects the ear to the nose, because of the swelling inside, the lumen gets narrow, small inside. Proper ventilation doesn't take place. So, during cough and cold time, either you use some medication, nasal decongestant before you fly, or if possible, try to postpone your travel. So these are the different mechanisms, or different ways by which you can prevent the otitic barotrauma or pain or block sensation in the air during the time of flight. And also, usually during sea diving, also the similar mechanism occurs.